We all want our family and friends to be healthy and have good quality of life. We also want our families and friends to be able to make right decisions when symptoms and a diagnosis is made. You want to be able to make a decision on surgeons, on hospitals, on rehab facilities, skilled nursing, and when the time comes, nursing homes. The book was endorsed by Joyce Kohaywick, who is an Emmy-winning commentator and a 3-time cancer survivor. When she is speaking or writing, she always tells ladies and gentlemen, please get a second opinion, get a third opinion, it could save your life. Now, Joyce had battled with 3 cancers. Somewhere within the 3, she realized that she needed a second or third opinion, which probably saved her life. I sent her the manuscript. She agreed with me in that, and that's why she went on to endorse the book. My name is William Riley Butler. I am the author of Navigate the Medical Maze, which is #1 on Amazon's bestseller list. I wrote the book so that people would understand the importance of second opinions. The readers and the audience needs to know what resources they can use if symptoms start to arise and they have to make medical decisions through the maze, which is fairly complicated. They also need the tools. The tools will be able to allow them to identify the symptoms and be able to address what next steps that they have to do. The comparisons. I wrote the book because I don't want people to do what I did. And that was, I didn't go for second opinions. I had one doctor send me to a specialist, 2011. For my spine, I got an infection. 2015, 2017, a friend of mine sent me to a South Shore Hospital specialist. In all 3 episodes, I contracted an infection, a bacterial infection that you only can get from the operating room. Now that led to 11 operations, 12 rehab facilities, 5 different hospitals, 4 different specialty surgeons, 2 infectious disease surgeons, and 2 near-death experiences. Let's get back to you. You have to understand that the doctors, nurses, and patients have put their testimonials into the book. So it's not just my view of what happened. It is doctors, nurses, and patients. They've opened up and told their stories so that you will be better prepared for the next thing that you're going to have to do, the next step. One, they all know that it's good to compare doctors, rehabs, hospitals, and when the time comes, nursing homes. They also know the importance of advocacy. Advocacy is extremely important because it'll help you make positive decisions. Now, when you're comparing, you have 1 or 2 or 3 surgeons. Those will consult. The other facilities, 1, 2, and 3. So the advocate can go with you on all those consulting and visits, investigations, and write down notes. While you're asking the questions to the doctors and their teams, the advocate is writing the notes so you can concentrate and focus only on what the doctor and his team are saying. Then, at one point, you and the advocate get together and look at the reports. And you look at what she wrote. Now note, I said reports. Reports are extremely important. So at every consultation and visit, please ask for the medical notes. You combine those and you will make a better decision. When you've accomplished your consultations and your visits for investigation, What questions do you ask? How do you ask a question to the surgeon and all the multiple surgeons that have? All the same with the facilities. Navigate the medical maze tells you what questions they ask in each area, each category. We're talking about surgeons, those are consultations, and the other facilities are investigations. We tell you exactly what to look for, so you have visuals and possibly the smells, so that you can delve down into the quality of the facility. Have you ever gone in to visit medical professionals and they ask you, what is your pain level? And you're really not sure what it is? In the book, we investigate the pain scale, what the symptoms are associated with the levels of pain. That way, or the range, and that way when you go visit the medical professionals, you can give them somewhat of an accurate number. That will lead them to a better diagnosis, which leads to better work that they're going to have to do. The doctors will be able to take that pain level and make a better diagnosis, and they can move on from there. The pain scale is there to help you, and you must take a look at it. It will create symptoms and help the medical professionals. But we also have an incapability scale. And I'll give you an example. In the book, there's Kim. Kim was a teacher, and she developed symptoms where she couldn't stand, she was dizzy, she even once or twice fell down, and so on. So she went to 4 specialists. 3 of them asked, what is your pain level? And she said, well, I don't know, but I would say a 2. And they gave her MRIs and x-rays. Didn't show anything. But her pain level was 2, so they suggested that she go to therapy. But the symptoms still continued. And when they continued, she decided to go to a 4th specialist. That specialist took all the reports from the other doctors and listened to what she was talking about. Then he asked, have you done a CT scan? And she said no. So they did a CT scan, and it showed that she had a spur on her spine. I would like to have you please read Navigate the Medical Maze. I want you to be the apostles, the disciples of the book and the content of the book. If for some reason one person that you know could use even a section of it, and it helps them and might even save a life. So do your due diligence. Otherwise, you're going to have the pain that I had. It might be a walker, it might be a wheelchair for the rest of your life. I made it through. I fought and it worked. And I had good doctors because at that point I had 2nd and 3rd opinions. I want you to read the book, and any speaking engagements that anybody wants to offer me, I will gladly take them. Because you as the disciples and me as the author could save lives. I want you to have good quality of life and good quality of health. Have a good day. Thanks.